So for Brunstone's approach, we will be using Ramist's phenomenon. So for Ramist's phenomenon, we will be applying resistance to abduction or adduction of the patient's non-affected side of his or her upper E or lower E. And then same response will evoke at the affected side. So for example, when I try to resist the patient's non-affected side, so for example, my right arm, I will be resisting the my right hand when I do abduction. So when I try to abduct while being resisted, my affected side, the left arm, will also abduct. So that's for Ramist's phenomenon.
Now for the Bobeth approach of rhythmic rotation, I will be using my right upper extremity. So as a PT, I will be in charge of facilitating the rhythmic movement. I will have the patient lie in a supine position and facilitate rhythmic rotations in the right arm until I finish their full range of motion.
So the next is the Rude's approach. So first thing that we will be doing is tapping. So tapping is the use of a light force applied manually over a tendon or muscle belly to facilitate a voluntary contraction. So tapping is used to assess reflex activity with a normal response being a brisk muscle contraction. So Rude recommended to do 3 to 5 taps over the muscle belly. So to perform tapping, um, what we're going to do is they're supposed to be um, the PT should be assisting the arm, like may makapot di dapat asa dre sa iya dre dalam. Tapos we will ask the patient to flex his or her arm. And while the patient is flexing his or her arm, we will be tapping the muscle belly. So, so for example, we will i-ask kong patient to flex his or her hand. So, until nga ma-flex siya. That's it. That's for tapping in roots. So for Rudes again, we will be performing brushing. So brushing is a therapeutic technique to facilitate movement responses and enhance static holding postural extensors. So in brushing, this allows stimulation of the fibers, especially C fibers. So C fibers are responsible for communicating pain to the body. So when doing brushing, this helps to facilitate tone in the muscle. So to perform brushing, all we need to do is to have a brush, but for today I don't have a brush, so an imaginary brush. So all we need to do is to use the brush at the patient's arm for 5 times. So brush 5 times. Then after brushing for 5 times, you need to stop for 30 seconds. Then apply the brush again. So after doing the brush, um, this will help facilitate tone in the muscle. That's it for brushing. So another technique for Rudes is by using ice. So using ice is used to facilitate a muscle response, which uses a combination of coolness and pain sensation to produce the desired response. So in order to perform ice, so for meantime I don't have ice. So again, let's try to imagine that I have an ice, and in performing ice, you should make sure that you have a towel. So let's say um, this is the towel and this is the ice. So for example, I'm trying to um, use it for the wrist extensors. So first thing we're gonna do is to rub the ice at the muscle belly of the wrist extensors for 5 times. So 1, 2, 3, 4, and 5. Then after that, ask the patient to extend the patient's wrist. So there. Then don't forget to wipe the um, the belly of the wrist extensors, patient's arm. So and then try to do it again by rubbing the ice. 1, 2, 3, 4, 5. Then wipe. Then try to ask the patient again to extend his or her wrist. And that's it for ice.
Now I'll be demonstrating the D1, D2 flexion extension pattern on the lower extremity. So, internal rotation of the hip. Then this is for D1 flexion and extension. For D2 flexion and extension is this, 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 and that. Now for the contract relax technique. I would initiate it with passive stretching, which I will be holding for 10 to 15 seconds and have the patient produce a concentric contraction up until the patient's full range of motion. And after the patient does do that, I'll then proceed with producing a passive stretch and exceeding from the normal range. So that's what would take place in a passive, in a contract relax technique.